There is something going on. This is the world crisis.
When his family members started falling sick and dying, Idrissa Lo rushed back from the United States to Senegal. On Wednesday, he mourned a fifth relative lost to COVID-19 as a third wave sweeps through a largely unvaccinated population and threatens to overwhelm hospitals.
Yeah, they got sick. Like the one I lost like 2 hours ago is my really close cousin. He's young. He's like 40 years old. And he was sick. He was at the hospital for 2 weeks. And he finally passed away today.
Senegal had largely been spared the levels of death and infection seen in other parts of the world. Until this month, the West African country had recorded 44,000 cases and 1,166 deaths since the start of the crisis. But in July alone, more than 15,000 cases and 139 deaths have been registered.
I was in a cemetery yesterday. In one day alone, average, usually we bury about 3-4 people. Yesterday alone, they buried 35 people.
Dr. Khadiata Diallo, head of infectious diseases at Dakar's Fann Hospital, says health services are being stretched dangerously thin, and that every bed in the capital with supplemental oxygen for those in severe respiratory distress is taken.
We've never seen this. We've never seen patients, especially young ones, arriving in respiratory distress. We had serious cases. We had deaths during the first 2 waves, but the number of deaths and serious cases that we have now, we've never had before. This third wave, to be honest, this third wave threatens to drown us.
Cases have exploded across Africa in recent weeks, hitting a fresh record of nearly 50,000 new daily infections in early July. Senegal, like much of the continent, is especially vulnerable because so few people have been vaccinated. It's administered under 1 million doses to a population of around 16 million. This week, deliveries from Sinopharm and Johnson & Johnson arrived, as well as AstraZeneca shots under the COVAX sharing scheme. Outside the Yoff hospital on Wednesday, hundreds like Ndeye Dia were queuing to be inoculated, with many arriving before dawn.
Everyone is here. We're moving now because we used to say it was for the elderly, but now we see 13-year-old kids getting sick. We see younger people in their 20s dying because of this. It's total panic now.
The Senegalese health ministry has vowed to ramp up immunisations. It also plans to build a plant to manufacture vaccines. Production is expected to begin later this year, with the facility producing 25 million doses per month by the end of 2022. But for those like Idrissa Lo who have lost loved ones, it's already too late.